Dr. Taylor has been a colleague of mine I've admired from a distance for many years, and then he published a dynamite paper that he's going to share with you information about it. But he has a very distinguished resume I want to briefly mention to you. He is currently the chair of OBGYN, Obstetrics and Gynecology, at Yale Medical School. But in addition to that, he's the immediate past president of the Society for Reproductive Medicine, and he's an expert in infertility and endometriosis and some of the serious chronic health problems that affect women today. He will share with you his own odyssey as to how he became so interested in this issue. Before we go on, though, I want to tell you all about a very exciting development for Environmental Health Trust. Governor Mark Gordon, who is likely to be our next governor again, wrote this letter recently to the Federal Communications Commission. And he wrote it in response to a lawsuit that had been filed by Environmental Health Trust, where the U.S. Circuit Court of Appeals for the District of Columbia ruled that there was substantial evidence in the record that the Federal Communications Commission had not taken into account in their decision to tell people that their 25-year-old standards were still valid, which is a decision that we obviously object to. Before discussing that, though, I want to give a little commercial message here for looking at effects in dads as well as moms. Dr. Taylor is an expert in pregnancy and its outcomes. But one of the things that's important to remember is it takes two to tango. And 50% of the genome comes from the male. Without doubt, many of the damaging effects can occur during pregnancy, but some can occur prior to it as a result of the sperm exposure. And in particular, infertility problems have been increasing. And among the things we know increase infertility problems in men are the things listed here: alcohol, drugs, pesticides, metals, tobacco. All of these things have been shown, both experimentally and in studies of humans, to increase problems of reproduction. Now, Dr. Taylor will talk to you more about the importance of experimental findings and human findings, because he does both. Without further ado, I give you my colleague and dear friend, Professor Hugh Taylor.
Well, thank you, Devra, and I want to thank Environmental Health Trust for putting on this program and sponsoring this, and thank you all for coming, and thank you for our home audience who will be looking at this in a recorded version. So I'm going to talk to you a little bit about what happens during pregnancy, what happens during development. It is a particularly vulnerable time, a particularly sensitive time to any perturbation. And there are many common exposures that we still don't have characterized well enough that people are exposed to, and we need to learn more about them. Again, we're surrounded by things that potentially could be harmful, especially during this vulnerable time of fetal development. And as an obstetrician, I personally feel that we should be the protectors of fetal development, protectors of the fetus, to help ensure that we have a normal baby and a normal lifespan after that. But we see in our food and our food containers, chemicals, contaminants, medications that may have some adverse effects. We see cosmetics and personal care products that have various chemicals in them that we believe are harmful to development and during pregnancy. And we'll talk a lot more about EMFs, the cell phone radiation, cell phone towers. I'll talk a little bit about that during development, and then our next speaker will talk to you a lot more about that as well. But the theme here that I want to stress, this is a cover of Time magazine from several years ago, is that what happens to the fetus carries with it for the rest of that individual's life. That this is a very vulnerable time where organs are developing, lots of things that may not affect us as adults can affect the fetus. And not only that, whatever happens to the fetus when those organs are developing, if they don't develop properly, that's it. You're stuck with those organs for life. It is a vulnerable time and a time that really carries forward into the future. Not only some of these agents that are harmful from the environment, but all sorts of things we could do better to make sure we have healthier lives. A lot of heart disease, some cancer risks, obesity, diabetes are all programmed, the susceptibility, when you're still a fetus inside your mother. And we know that this is such a vulnerable, important time. We need to guard it carefully. What happens to us at 50, 60, 70 at least had some of its roots in what our mom did when she was pregnant. The first thing I want to talk to you about are endocrine disruptors. You know, pregnancy is a very hormonal time, obviously, and there are lots of things in the environment that mimic hormones. Endocrine disruptors are chemicals that have hormone-like properties, and you can imagine they can interfere with pregnancy, but also are very common. They're found in industrial chemicals. They're found in hormones that we may take or that may be other people taking that we're exposed to in our water supply. They're found in some drugs that are not thought to be hormonal, or at least not advertised that way, but may have hormonal activity. Pesticides, herbicides, various things that are on our food. If we're not eating organic food or don't clean it thoroughly, we may get exposed to things that have hormone-like properties in our food. Personal care products, makeup, have hormonal properties that are well documented. So lots of areas that we're exposed to. And not only pregnancy, but all sorts of hormonally regulated organs as adults, but in the fetus as well. As these are developing, they may be particularly sensitive to these hormonal inputs. Not only that, but organs that we don't normally think as endocrine, hormone-producing or receptor organs are also very sensitive to hormonal input. The brain and lots of other organs very sensitive to hormones during development and need the right hormonal balance to develop properly. I've always been very interested in the environment and what environmental agents may in fact impact a pregnancy, and that's what brought me to study this. And one of my heroes was a guy named Lou Gillette, who was one of the original crocodile hunter. And he would go in there and wrestle these alligators and examine them. And I knew Lou. He still had all his fingers and toes and limbs when he passed away, unfortunately, a few years ago. But he started by looking at alligators in areas in Florida that were either around places that had either industrial or farm runoff and a lot of contaminants in the water versus those that didn't, in really sort of remote, more pristine lakes. And what he found is there were all sorts of problems in the offspring. Not as much in the adults, but the offspring. The fertility was reduced, the fetuses, the babies and the eggs didn't develop as well. And then after they were born, they had infertility problems, they had altered reproductive organs, lots of different effects. But of course, you know, people dismiss this. These are just alligators, some swamp creature that who cares about that really? Does this really happen in people? And unfortunately, from an experience we had with diethylstilbestrol, I don't know if any of you have heard of that, but some of you probably have. This was a drug given to pregnant women. So we know from some of the bad things that happened with this drug that this hormone that people were exposed to during pregnancy can have awful effects on the offspring. Diethylstilbestrol is an estrogen-like hormone, and it was thought that giving more estrogen at a time when estrogen is very high in pregnancy would be a great thing. It would help prevent miscarriages and help prevent preterm birth. It did none of that. But these were the kind of ads in the 1940s and 50s and 60s that were running. You know, prevents abortion, miscarriage, premature labor, recommended for routine prophylaxis for all pregnancies. This is what we were being told at that time. It wasn't until the 1970s that we found some horrific cancers that formed in young women that was recognized that this was a bad thing and people stopped using it. But what it did is it caused the reproductive tract to be misshapen. And this is what we call a T-shaped uterus. That uterus should normally be pear-shaped. Plenty of room to fit a baby. That's a very narrow T-shaped uterus. A baby can't really grow normally in there. Leads to miscarriages, leads to premature deliveries, all sorts of terrible reproductive outcomes. And this is in the daughters of women who were exposed to this hormone when their mom took it in pregnancy. The lasting effect that didn't show up till 20, 30 years later when they went to reproduce. And it was hard to link it back to that exposure. Who knows what your mom took? But enough people did do that serious work to link these things back to mom's medical record to find out if she took DES or not, and prove that this was really causative, that this led to all sorts of problems later on, again, infertility, other hormone-sensitive diseases like endometriosis are increased, pregnancy outcomes that were adverse, and even some cancers now that we're finding are triggered by this exposure to the fetus when this woman was still inside her mom. So what her mom did was, again, not through any fault of her own, what was recommended at the time to take DES really had some adverse consequences that lasted throughout her entire lifetime. But this is just one. This one we can study carefully. It's well defined who got DES, who got the prescription, and who didn't. We can define it. But it's one of a sea of different hormones, and especially estrogen-like hormones, that we're exposed to every day that we don't even know about and have no way of measuring. And we don't know what somebody's mom took when they were pregnant. And there's no way we can really make these kind of tight correlations that we did with DES, where we can identify an exposure and look at the outcome. One of the ones I've studied quite a bit is bisphenol A, and many of you probably heard of this. It's in plastics. It's the agent that polymers of this BPA make plastics harder. So it's in those hard water bottles, not the squishy ones you buy in the grocery store, but the hard permanent water bottles or the big water cooler bottles, the things that make plastic very hard. This is also a hormone, though. And it is something that we are all exposed to, either by plastics or the sealants, the epoxy resins that line all canned goods have BPA in it. So if you eat anything that comes out of a can ever, you're exposed to BPA. And what happens when we treat animals with BPA is we start to see all sorts of problems, especially in pregnancy, even in the adults, but especially in pregnancy, which is my interest. We see problems with obesity, metabolic changes. We see changes in their behavior. We see changes in their fertility, and hormonally sensitive cancers even increasing. So this is really dangerous, and we're all exposed to it every day. So we're all exposed to this. You can measure bisphenol A, BPA, in the urine of about 95% of people in developed countries. We're all exposed to it all the time. You can measure it in the placenta. You can measure it in mom's blood. You can measure it in a fetus's blood. It crosses the placenta. Essentially everyone today is exposed to this. And it does cause these problems in the animal studies. It is an estrogen-like compound. Again, it mimics a hormone. It looks like estrogen. It behaves like estrogen, except not quite. But it's been dismissed because it's a very, very weak estrogen. And there's always somebody who wants to dismiss all these findings and say it's not really relevant to people. But bisphenol A is because it's such a weak estrogen. They said, well, it probably can't really have much of an effect. We have so much estrogen floating around in pregnancy that it's been often dismissed as not feasible. But I want to talk to you about some work we've done, and I'm sorry if I get a little technical here, but I'm really proud of this work. We just published it this year, and it's a real breakthrough in understanding how a weak estrogen can do something like this. How can such a weak estrogen have a powerful effect? Well, we studied a naturally occurring estrogen in pregnancy called estriol. Estradiol is the one that adults make. This is a special estrogen that's made in massive amounts during pregnancy. This is just a graph that showed that E3 is this particular estrogen. It goes from 0 to as much as any other estrogen in pregnancy. And it's a weak estrogen, 1/10,000th the potency of traditional estrogens. So what are we making this for in pregnancy? There's a very complex pathway that's evolved that we are intentionally making a lot of this estrogen that is a weak estrogen that shouldn't do anything, and nobody's ever found a function for it until this year when we did. What we found is it actually does something called methylation of DNA. It's an epigenetic modifier. And let me take a minute to explain this. And I'm sorry for those of you if I get a little too technical here. But again, I think it's a very important point to show how these things work. We know that DNA can be chemically modified. The DNA that we have is basically the hardware. And how it's modified is the software that tells what organ, we all have the same DNA in every cell in our body. What tells one organ to become the brain and one to become the heart and one to become something else? It's this epigenetic modification, genes that can be turned on or off. And just to show you how powerful that can be, this is the same organism, this is the same animal, same DNA. The caterpillar transformed into the butterfly. It is all through this epigenetic programming. You turn different genes on or off, and this caterpillar changes into the butterfly. Just show you how powerful this epigenetic programming can be. And to make a long story short, the normal role of this estrogen, and this was our finding this year, was to change that epigenetics. It adds those methyl groups onto DNA and turns genes on or off. That is its role. That's why humans make it in massive amounts in pregnancy. That is how it interferes, how endocrine disruptors, the chemicals that we've talked about, they actually interfere with this estrogen, not the traditional one that everybody's thought about as the potent one. It interferes with the pregnancy estrogen, estriol, this other weak estrogen, which has a role in epigenetic programming. They're not blocking the old-fashioned estrogen that everybody else talks about that made it easy to dismiss this. They're blocking this very weak estrogen, and if we look at traditional estrogen potency, but a very, very strong estrogen in terms of its programming of development. That's why it's there, that's why it's made, and these endocrine disruptors interfere with that. So finally, we have a mechanism that explains how these very weak hormones can have profound effects on development. I want to just go a little bit into cell phones. Our next speaker is going to talk, Hillel will be talking a lot more about EMF and radiation. It's something else that we saw a lot of studies in humans about correlations between cell phone use and behaviors and behavioral alterations, ADHD, behavioral alterations like that in children of women who are on their cell phones a lot during their pregnancy. So I started to wonder whether that really was causative. There are people who dismiss some of those studies. Well, of course, if a woman's talking on her cell phone all the time and ignoring her kids, they're going to have behavioral problems. No, we thought it would be a lot more than that, that there probably really would be cause and effect. So we did an animal study, and we were the first to do a study to specifically look in a mouse model. And here we just took regular old cell phones that everyone was using, put them on top of the cage of the mice that were pregnant, or had a cell phone that was deactivated on top of the cages of half the mice in separate rooms, and just similar to human exposure, and exposed to these cell phones throughout their pregnancy. Nothing, same genetically background mice, the same environment, the same diet. There are no other confounders in there that would have potentially interfered with this. The only variable that was different is whether they had that cell phone on or not. So we could really say it was caused by the cell phone. And this is what we found. I'm sorry, this may be a little bit small for those of you to see, but this looks, the first one here looks at memory, and the one with the open circles are those that had the cell phone exposure. And you can see that their memory was decreased. They were much more hyperactive, and their anxiety was actually lower. So they were bouncing off the walls, not remembering what they're doing, but didn't have a care in the world. It didn't bother them. So again, very, very similar to what we see ADHD. So a good mouse study that really proved that. Others have done that, and I won't go through all these because I think it'll overlap a little bit with our next speaker, but there are other studies that have come on since this time that have seen those same sort of correlations in women, especially women who are pregnant, who use cell phones during their pregnancy, and children having various behavioral problems due to that cell phone exposure. And other animal species, even the zebrafish model has been used as well, where you can expose a fish to cell phone radiation and see various types of abnormalities, including the type of behavioral abnormalities we saw in mice. So it's correlative in humans, and we see it very clearly in our mouse models, and it affects all sorts of other species as well. This is broadly applicable. Really don't use your cell phone or wireless laptop, certainly on your abdomen. A laptop probably shouldn't be on the lap, especially if you're pregnant. And keep it away from you. Don't sleep near your cell phone. Put it away from you when you're in your car driving. Put it on the other side. Turn it off. Put it on non-broadcasting airplane mode whenever possible. And just generally minimize your exposure, especially when you're pregnant, especially keep it away from your abdomen, because the fetus really is vulnerable. You know, I want to say we'll never have perfect evidence in women, because we're not going to expose women to things that we think are harmful and test whether it's harmful or not. We're not going to do those experiments. It's going to be correlative experiments. And somebody will always say, well, you know, the women using the cell phones, the women exposed to this particular chemical had all these other exposures. How do you know that was really what's causing it? And you can't in these human studies. But in animal studies, we can do that. We can isolate it so they're completely identical. Again, the same genetic background, the same diet, the same exercise regimen, the same light-dark time, everything you can think of, these animals are identical except this one exposure, whether it's one of the endocrine disruptors I talked about, whether it's the cell phone radiation. We can do those experiments and we can show that it's cause and effect. There's nothing else different between those two groups, and one has these adverse outcomes. So when these two align, I think we have pretty convincing evidence that when you show its cause and effect in an animal, and when you also see the correlations in people, I think we can be pretty convinced that really this is truly causal in humans, and we need to watch out and we need to be more careful. What I've shown you, though, is just really the tip of the iceberg. I've talked about a few hormone-disrupting chemicals that I know about and have studied, and we know about quite a few, but there are many more out there. We live in a sea of thousands of chemicals. Our exposures to various electromagnetic fields is increasing and changing. I think these are all things that we really need to study more carefully. And although we don't have all the answers, we know that environmental exposures clearly play a role in the health of the next generation, and there are things we can do now to protect the next generation from these exposures that may not even be manifest till decades from now, but we need to think and act now to prevent and protect our children. So, you know, we can already identify some things as really very dangerous, some things as less harmful, but we need to do a lot more research to identify exactly all of the different compounds out there and really quantify which are the safer alternatives and which are the really dangerous things that we need to avoid. Now, we know some of them, but as I said, it's just the tip of the iceberg. So anyways, thank you very much. I appreciate you all coming out tonight, and I'll turn it over to our next speaker, Hillel.
So it's an honor to be here again. I realized as I walked up the pathway that it's a deja vu. I'd been here before, and Devra had invited me in the winter of 2018 to speak on a similar topic, and as she mentioned, I've rewired and now have more time to devote, you know, to this effort. I just want to applaud Hugh's talk, because when I hear a fellow physician who is concerned about these issues in terms of prevention and not just treatment, because my own colleagues in neurosurgery, we're in a minority, Hugh and I, and we hope to be able to spread this message that is advanced as we are in our technologic medical environment today. It is equally as important that the technology that we use to treat our patients is also potentially harmful for us, and that we need to, hopefully, that you'll take home from this talk, the concept that it's a balance, and we're trying to achieve this balance between our rapidly advancing technology and also taking into account the potential harmful effects. So today I'm going to delve into the greater details of electromagnetic fields and the effects of 5G cell towers on the brain and central nervous system. And how did I get involved in this? Well, full disclosure, my wife several years ago found out that she had electrohypersensitivity. That's an entity where they can actually feel cell towers, they can feel dirty electricity, they can feel the effects of even having a phone on in a car. Work people could come to the house, and we had a sign on the door that said, please turn off all cell phones and devices. And she would have a sensation and ask them, is there something that's potentially on? And sure enough, it might have been an iWatch or an iPad that was in their briefcase that was still on transmit mode. And I'll get into this, everybody is potentially electrohypersensitive, but some are simply more sensitive than others, as in simply are symptomatic, more symptomatic than others. So in 2019, we attended this environmental conference in Scotts Valley. That's where I met Devra Davis, who I owe a debt of gratitude for getting me involved in this arena of electromagnetic fields, and then the energy and camaraderie that was present at that conference was really impressive to me. And so there are some major players also in environmental health in Tucson, and we decided to put on a conference in 2021 that was going to be live, but then it was scuttled by COVID, but we had it virtually, and I think we had something like several thousand participants online. Devra spoke, I moderated. It was really a wonderful conference of great minds from all over the globe and participants from all over the globe participating in this. So it's an honor to be here and be involved in this work. So segueing from Hugh's talk, as he said, we have to protect the vulnerable. And children are more vulnerable to wireless electromagnetic radiation. Electromagnetic radiation comes from cell phones, it comes from Wi-Fi, it comes from 5G, it comes from Bluetooth. And so the children have thinner skulls, they have a higher water content because the developing brain, ultimately our brains are predominantly lipid, are fat, but a developing brain has more water than fat, and as they age, they produce myelin, that's the coating around the nerve sheath, and that's a fat-based membrane. And so they're vulnerable to all of this electromagnetic radiation at a rate that's 5 times higher. Stem cells are also affected. What are stem cells? Stem cells are pluripotential, meaning a stem cell can become anything. It has the potential to become a bone cell or a nerve cell or a blood cell. And in children, their stem cells are found to be more impacted by radio frequency. And so the diagrams that you see on the right are from Fernandez, who also did the same study with the sperm count that Devra showed in the prior slides. And so ultimately our organs, nervous system, and undeveloped organs are more vulnerable. As Hugh mentioned also, behavior, memory, learning are also affected. American Academy of Pediatrics already noted, and this is old news, right? But 30 minutes of just increasing screen time with increased risk of extensive speech delay. Memory's affected. We have Europeans involved. ADHD, as he mentioned, with the perinatal studies in 5 countries, in Northern Europe and Spain, and also the neuropsychiatric effects of over 26 studies showing fatigue, headache, nausea, and symptoms of electrohypersensitivity. Martin Pall was a pioneer in this field, and he's one of the leading researchers in the effects of electromagnetic fields. I unfortunately did not get to meet him. Cell phones, headaches, and migraines. NIH actually funded a research study on over 50,000 children, and both prenatal and postnatal exposure to cell phones had more migraines and headache-related symptoms, and this is actually unusual for more mainstream researchers to actually conclude that the findings actually showed that smartphone electromagnetic radiation can actually trigger effects. Microwaves produce neuropsychiatric effects, including depression. And so what's the mechanism of this? And in the interest of time, I had to sort of dial down, how does all this happen? What's going on between the electromagnetic fields coming from a cell phone and the cells? And so what's happening is that our brains, our bodies, our most vulnerable organs are actually our hearts and brains, are powered cellularly by an energy pump within the cell called the mitochondria. And the mitochondria have membranes. And these cells are affected by these radio frequency fields, and actually the cellular DNA and the mitochondrial DNA are both affected. And so what's happening is there's a stress reaction. And so the cells are literally stressed, and then we have things called voltage-gated calcium channels that, if you can imagine a cell membrane, our radio frequency radiation affects these voltage-gated calcium channels. They're channels where you see molecules going through the cell membranes, and those are all affected. The neurotransmitters are affected, and as Hugh mentioned, hormonally, there's also neuroendocrine cells, and those are also affected. There's a thing called oxidative stress. And so there's a well-known pathway in medicine, which again relates back to the mitochondria. The mitochondria is the powerhouse of the cell. And there's actually slides that had to delete that showed how the hydrogen bonds in the helical DNA are affected by radiofrequency radiation. Having a brain tumor, whether benign or malignant, is a life-changing event. And so no matter that we may have the most wonderful surgeries to resect these, no matter that maybe it's a benign tumor and the patient can have a successful resection, it's still a traumatic event for the patient and their family. And it puts them at risk, not only just being in the hospital, but for infection. And so it's really better to go through life without contracting a brain tumor. And what you see here is an aggressive brain tumor. It's likely a glioblastoma, GBM. You see on the upper right picture, that's the slice through the side, and you can see the white part, and that's where the enhancing tumor is shown on MRI. They give an agent called gadolinium, which is theoretically a safe bound metal that's excreted in the kidney, and then the other image is the cross-sectional image looking this way. It's the axial image. And so that's just an example of what brain tumors look like. And these can present where the patient has been minimally symptomatic, and ultimately they'll show up in the emergency room and they can have advanced disease like this. And this is not an uncommon first presentation of what I saw in practice for close to 30 years. And so even though we have death rates decreasing, we're successful in our treatments. We've got newer chemotherapeutic agents. We've got navigation equipment. We have even monoclonal antibodies. We're not going to cure high-grade brain tumors. We're not going to cure glioblastoma, at least in my lifetime. And so the brain cancer rate is increasing in both adults and children. 0 to 14 ages. Ostrom is from Duke, is a well-known epidemiologist. We also have pediatric brain, kidney, liver, thyroid, all increasing over the last years and also increasing up until now. These are earlier studies. 4,600 people, as in children and adolescents, are diagnosed with a brain tumor each year. And the last line relates back to a Blue Cross Blue Shield study that was published just a few years ago that showed the overall cancer rates are rising profoundly in millennials. So they were 20s to 30s, and now they're approaching 40s, but now we have thyroid and rectal cancers and brain tumors, not to mention suicide, depression, and stroke, all increasing in this population. And as Hugh mentioned, yes, things are multifactorial. Is it solely the effect of our cell phones? No, not necessarily. We have toxins in our environment. But the fact is that we have never had more electromagnetic frequency in our globe up until now. In other words, it's never been, this is the highest rate that we have ever achieved in electromagnetic frequency in ambient environments in our world. And it's higher than it was when even those studies were published. So I hearken back to the inconvenient truth of our technologic epoch. And as Hugh mentioned again, we've got known toxins that commonly occur that we know are harmful. alcohol, heavy metals, solvents, pesticides, ionizing radiation, the radiation that you would get from an X-ray machine, the radiation that people got in the 50s when they had their feet X-rayed, the radiation that my patients who survived Hiroshima, Nagasaki got and presented with cranial brain tumors. I saw those in my practice over the years. And so, yes, that's a known entity. But when we talk about science and we talk about this inconvenient truth and people say trust science, we have to look at where that science comes from. There's all kinds of science. And my colleague, a premier neurosurgeon in Australia, Charlie Teo, was quoted in one of our conferences and said, just look at who funds what studies, because those make the difference. And so we have to keep that in mind when we review what's out there in the media, in the literature. And so when I have a colleague like Hugh show up in a meeting like this, it's just especially refreshing. So lastly, as we're now talking about today, the non-ionizing radiation is definitely an issue. So one of the major studies that's referred back to in this arena of radiofrequency is the National Toxicology Program study. 2018, $30 million, 10 years. The conclusion was clear evidence of brain cancer from radiofrequency. And yes, it was a rat model. And of course, those who would like to criticize our interests in terms of our concern about radiofrequency point to the fact that it was rats and mice. But gee, we actually share very similar DNA. And there's a host of other therapies that perhaps many people in this room are getting in terms of general cholesterol drugs, antihypertensives, diabetes medicines, chemotherapeutic agents, heart meds, interventions that were all based on rat models. But yet we have a study that was then reevaluated by the Italians, the Ramazzini study, and was corroborated, and they found that it increases in the same tumor types as the National Toxicology Program. Over the years, I treated a number of tumors in a number of patients, from children, adolescents to adults. And my gut was always the sense that radiofrequency played a role somehow in the presentation of their tumors. And so I treated acoustic neuromas. The schwannomas that are mentioned here in the NTP study occur in the heart, but it's a nerve cell tumor, it's a nerve sheath tumor, it's a tumor of the myelin that I mentioned earlier, of the lining of the nerve cell. Those schwannomas can occur in the heart and they can occur in the brain, and they occur on the acoustic nerve. And so it was very easy for me to have a patient with an acoustic neuroma, because this was an area of my specialty, and I'd simply interview them about their cell phone use. And everyone used the cell phone on that side of the body, on that ear specifically. And so all I had to do was warn them going forward. Many of them lost hearing as a result of that tumor surgery just to get the tumor out. We had to potentially sacrifice the auditory nerve. The facial nerve would run right with it. And so it was much more important to preserve the seventh cranial nerve, the facial nerve, and sacrifice the acoustic nerve, because the nerve tumor had literally grown into it. So that's just an anecdotal thing. And I don't have the numbers to support that, but there are articles in PubMed.gov, and I found them. And there are correlative studies in humans on large numbers that show the cell phone use with correlations with the schwannomas. So we mentioned cell towers. Many of us, most of us, we don't see it. Of course, now we see it. I think it's a blight on our country, especially if it's in a national park, but we didn't used to see it. Now we're seeing it. We can't feel it. Some of us actually do feel it. I think that when we disconnect, when we actually do take digital breaks, when we give ourselves that time away from radiofrequency, your bodies actually can feel the effects of a cell tower when driving by it. And so over time, cumulative damage occurs, and the issue, of course, is that long-term, all of these things are cumulative, and so we can't possibly anticipate what's happening as a cumulative dose over a lifetime. This is a very busy slide, but it's simply up here to show you that as early as the 1990s, and these are all little reference studies that refer to an article, but as early as the 1990s, they found effects of radiofrequency that involved brain cancer, heart, oxidative changes, reproductive changes, sleep changes at levels of radiofrequency exposure that were all below the recommended FCC and Canadian limits. And so at these low exposures, all of these studies found significant effects. And so the dilemma that we're facing is are we looking at a society in which technologically acquired disease is now being treated with high-level technology? And so here's an example of my colleague who's chairman of NYU, John Golfinos. He's an outstanding neurosurgeon. This came out last year as an advertisement and a promo for NYU, and they have the best and the brightest of neuronavigation techniques, intraoperative MRI, and we can treat your brain tumor with the best of the best. But the sad part is how did we acquire that brain tumor? And is this the future of our world, of our society, to simply focus on technological treatments for things that are potentially preventable? This was an NIH study from 2012. I want to preface this by saying that I don't think we've ever seen a smart fish. I'm a fly fisherman. And when you go fishing, you feel like sometimes you caught the same fish because they go after that fly and they go after it. And so why aren't there smart fish? Well, oxygen has to diffuse through water into gills, and fish don't have enough oxygenation to develop a brain that can understand logic. But those cetaceans, those mammals, whales, dolphins, porpoises, they come up for air. And they come up for air and they perfuse their brains with oxygenated blood, and they have highly developed central nervous systems. So now, if we look at PET scans in those patients who are exposed to cell phone radiation, and we look at the outcomes, we see that they end up metabolizing glucose, which is given to them as an isotope. They metabolize glucose in place of the oxygen. So what does that mean? That means that when the brains are exposed to cell phone radiation, they are not oxygenating well. They have to utilize glucose to process cellular function. And this is as old as 2012. So wireless radiation is, in fact, a neurotoxin. It's toxic to cells. Loss of memory, cells deteriorate in the hippocampus. The hippocampus is the inferior part of the temporal lobe that's responsible for our memory. Oxidative stress, I already mentioned. Demyelination. Demyelination is what happens when the lining of the nerve cells in the spinal cord and even in the brain deteriorate. It's the common occurrence that happens with multiple sclerosis. We mentioned oxidative stress already. I think the blood-brain barrier is very important to mention here in terms of what happens to our brains when we're exposed to cell phone radiation. The hippocampus is that area just here, below in the inferior temporal lobe. And when we do blood-brain barrier studies, what is the blood-brain barrier, actually? The blood-brain barrier is the microscopic interface of microvessels adjacent to neurons. And so this blood-brain barrier is an integral part of how our brains function and metabolize oxygen and glucose and food. And it's a very delicate thing, and it's something that we learn as neurosurgeons to actually manipulate in terms of head trauma or brain tumor patients when we see patients in the acute setting. And now we have evidence that when we expose brains to microwave radiation, we have leakage out of those vessels that I mentioned in the form of albumin, which is a protein. And we can see on the slide on the left is before the control, and after the exposed brain has the leakages of the albumin. We talked about learning impairments. We talked about learning and recall. I think you're getting the idea that there's just enough information out there in terms of multiple studies, in terms of test scores, attention deficit. What's interesting is that cell phones have been banned in certain countries, Israel, Northern Europe. And I think all of those have a lead on potentially our own country here. The question becomes, is artificial electromagnetic fields an environment that's going to potentially unravel the advances that we have made as human beings, as an evolutionary species? That's really what we're facing here. We're facing an unprecedented electromagnetic field exposure where theoretically we came from apes, but are we going to deteriorate in this environment over time? There have been multiple studies on people living near cell towers, even dating back even before this one. There was an early 2000 study of firefighters adjacent to cell phones with multiple symptoms, brain tumors also. India has actually banned cell towers in higher populated areas. I think we need to take their lead. So, how can we reduce exposure? France, Belgium, and Israel have banned the phones in school, and many schools in Israel are actually wired, meaning Ethernet, the cable that you see on the bottom right. Cabling a company, a school, a library is actually cheaper, more effective, and higher bandwidth than having recurring costs of Wi-Fi routers that are going to deteriorate over time. Devra's organization, the HT, has been involved in attempting to reduce these exposures overall. So, as I mentioned, it's a blessing and a curse because this technology has allowed us to advance in a lot of areas. As a physician, I had to be reachable 24/7, and so what did I do? I put my plane on airplane mode. I set it down. I made rounds in the hospital. I'm constantly turning it on and off, telling other people to turn it off, teaching my patients on how to live with a cell phone, because for many it's their only way of communication. And so it boils down to the judicious use of our technology that can be the least harmful for us.
Thank you, Dr. Baldwin. It's fitting that in this church we talk about a blessing and a curse because, of course, that is exactly what we face from God on high. We have blessings and we have curses, and we have to figure out how to lead our lives with blessings. And I will say again, thank you to Dr. Baldwin, Dr. Theodora, for being here, for all of you for coming out this evening. This is a complex issue, and I'm really honored to have a chance to talk with you about some of what we know. I've spent, unfortunately, more time than I ever imagined working on this issue, and in 2010 wrote a book that we are going to be reissuing later this year. But the most important thing to tell you is that government limits are 26 years old. The current standards for every one of the world's 8 billion phones and many more devices are 26 years old. And the U.S. Circuit Court of Appeals was so appalled by that, that when our organization sued and asked for an update of the standards, the court ruled that we had established the failure of the FCC to provide a record of reasoned decision-making. An agency is free to look at the record and disagree with what's submitted, but they have to give reasons. They can't just say, never mind. We happen to know that that's exactly what happened in the final decision when the rule was issued just before December of 2019. And the court ordered that the FCC had got to address the impacts of radiation in children. And we've heard, I think, from the talks today so far why that's so important. The court also held that there was a failure to consider any of the evidence on environmental effects. And that's what I'm going to talk to you about in a moment today. But I want to add one new finding from your colleagues at Yale, which is a study funded by the American Cancer Society, published just 2 years ago, looked at specific genetic mutations called SNP, single nucleotide excision repair, and found that people that had a fairly common SNP had a very high rate of thyroid cancer associated with cell phone use. And this was a rather robust study published in a very important journal, and yet we hear very little public discussion about this issue. Where is the thyroid? Here. You heard about acoustic aroma? Here. The brain tumors we're concerned about? Here. They're all right within the flow of cell phone radiation. Now, we are concerned about the deployment of 5G, and this community should be especially concerned because it ain't here yet, but it's coming. And in order for 5G to work, you need a 5G phone, a 5G router, a 5G computer. All their devices have to be new. 5G becomes a very effective marketing scheme. And yet in many countries where they have tried to introduce it, there's been a large failure to launch, if you will. What I can tell you is that these studies that I'm showing you here have modeled how much more radiation exposure there would be if 5G existed at the current permitted levels. So you see on the left of the image in front of you what you have currently simulated for Austin, Texas. And then on the right, you see what would be permitted with 5G. And by the way, that's what is now permitted in the town of Jackson. 5G only works ideally in an urban setting anyhow, because you need an antenna every 100 yards or so. And they have to be able to talk to one another and form beams. So a study was done in South Carolina, published this year, and they looked at the actual measurements found in certain areas in the town. And one of our projects in the coming year will be to measure radiation at distances that they're supposed to be a certain levels set by the FCC. And when those levels are in fact measured, and this is one example of it, antennas are found much closer to ground than they're supposed to be. They're put on things that look like street lamps, but they're not. All of those lovely street lamps that you see going into Jackson are in fact cameras, which is not a bad thing because you can tell if somebody's here who's up to no good, but they all can become 5G antennas very, very easily. And what we don't want to see happening is this exposure to take place without a full assessment of the environmental impacts that this radiation can have. Here is an example that you might not have thought of. This is a study of how radiofrequency radiation can damage trees. Now, trees have the advantage, like the zebrafish and the mouse and the rat, that they don't listen to the news and they can't be biased by reports. And so you look at this study and you don't need to be a rocket scientist to see clear evidence that the side of the tree closest to the tower there is dying. And it will take this tree another 10 years till the whole tree eventually is sicker and may not survive. And this is a statistical analysis that was published looking at radiation damage to trees by visual inspection and then putting a grid over it so that you count the number of leaves on one side versus another. And this is a Norway maple, and there are other trees that have been shown also to be damaged, similarly damaged significantly by their proximity to towers. This is a very important study that was done where they made a model of the honeybee, a three-dimensional model of the honeybee. Now, honeybees and pollinating insects are critically important for agriculture. There are over 2,000 different pollinators. It's not just the honeybee. And we see the hummingbirds are pollinators, where they're about to fly the coop now, so they're all drinking a lot of our sugar water. But hummingbirds, bees, a number of animals, all invertebrates, are pollinators, and this study modeled the honeybee body. And you can see that the 2 gigahertz, which would have been the old radiation exposure, it goes through. The color of red indicates highest exposure. But at 24 gigahertz, which is what 5G can be, it doesn't exist yet, but it can be, it goes entirely through and literally lights up the body of the bee. And that's an experimental study that has been done. Other studies have shown that there's reduced motor activity in worker bees. There's something called a piping signal that they do in order to tell one another to get to work and what they're supposed to do. And the worker bees and the bees that are supposed to be the defender bees, all of them show problematic behavior with exposure to this radiation in experimental studies that have been done where you take beehives and you put a phone in the hive, you put another hive with a phone in it, and it's not operating, and you turn on the phone in the one, you don't turn it on in the other, and then you have a control hive with nothing. And significant evidence occurs. Ultimately, the queens stop doing their job, which is to make lots and lots of eggs, to make more bees, to make more honey. And there have been a number of studies showing this, not just one. Our website has information on this. Now, the New Hampshire Commission on 5G specifically looked at the issue of wildlife, recently examining all the data that the FCC did not examine. They had a commission that Theodora will tell you about in a moment that had 13 different members who were experts in electrical engineering, professors, and specialists in their field. They looked at all of the evidence and was one of the first times to do that. And we were honored that Theodora, Scarato, our executive director, and I testified before that commission. And they took seriously all the information that was provided, and they concluded that safety limits need to be developed for wildlife. And I would urge all of you here in Jackson to see that that happens, because we are not protecting our animals if we are radiating them and interfering with cryptochromes, which is the hidden protein behind the eye in every migrating animal ever studied, whether a bird or a bee or a fruit fly. They all have cryptochromes that are sensitive to the Earth's magnetic field that can be interfered with by this radiation. Now, where are we on this issue? Remember this? This was an ad from the Journal of the American Medical Association. Dr. Mo Melian, our distinguished chairman, is here, and he trained in medicine long enough ago that he can remember when surgeons' conventions were full of smoke, and most doctors smoked. It's a high-stress job, right? And so these ads were boasting how tobacco was safe and refreshing and invigorating, right?
And they died about the age of 45.
And yes, he's adding that they died at about the age of 45 because some of them were so heavy, such heavy smokers. In my secret history book, I talk about the fact that the tobacco industry funded the National Cancer Institute to $11 million to make a safe cigarette in the 1970s. In the 1970s, and the head of the National Cancer Institute was a 4-pack-a-day smoker. So we've come a long way from the time when we believed that tobacco was good for you. And I think, unfortunately, we need to take a step back from our enthusiasm with the blessings of the technology, which are real and important and undeniable when it comes to things like emergency response, and when it comes to the ability to develop commerce in developing countries. There are real advantages, but we have to also take a question as to what are we doing to ourselves, our children, and the planet. And now I'm delighted to invite Theodora Scarato to provide us with an analysis of something that may seem a little bit highly specialized, but it's so important to appreciate that we are experiencing a major regulatory gap in the way we are looking at this issue. The FCC does not employ a single health expert, not a single expert, and they rely on outdated information that you're going to hear a little bit about now from Ms. Scarato. Thank you.
So thank you so much. I'm going to talk about how wireless radiation exemplifies the concept of a regulatory gap. When we think about wireless in our lives, it's everywhere. There's smart TVs, cell phones, and I remember when it was just cell phones, right? Now there's laptops, smart lighting, smart speakers, smart everything, and then a cell tower might be near your home or in your community nearby. A decade ago, I learned that cell phones didn't work by magic. They work by radio frequency microwave radiation. And one of the first questions I had was, well, is it safe? Are the levels that I'm exposed to every day safe for me and my family? I was told that the FCC was the agency, and it was within FCC limits. That's the agency in our country that has authority over cell towers and cell phone radiation. And as I looked in the research, I was shocked to learn the vast amount of research that we have on this subject, showing harm at levels that are well below our FCC limits. So in our lawsuit, I want to talk about this a little bit, Environmental Health Trust et al. Versus the FCC. The court noted a few things, a lot of things actually, but that there was silence from the agencies that you might expect would be responding. So they asked the EPA, the FDA, the Department of Labor, the National Cancer Institute, and other agencies to comment on our FCC limits. I mean, are they safe? What does the science say? Because the FCC is not a health and safety agency. And they were silent. There wasn't a response, except for from the FDA, which the court found to be cursory. And I'll talk about that in a minute. In the decision, it was found that the FCC's decision to not to update, not to change those 1996 limits was arbitrary and capricious, and that the FCC had ignored issues of long-term exposure, issues of children's vulnerability. In fact, Dr. Taylor's research was one of the prominent studies that we had submitted onto the record. The testimony of injured people and science showing impacts to the developing brain and reproductive organs. And the court also said that the FCC had completely ignored the issue of impacts to wildlife. The bottom line is that FCC limits cannot be thought of as resting on an up-to-date scientific review. So there's been no past or current systematic review of the totality of the evidence. And of course, I assumed when I learned about this that of course there was, scientists working on this all the time, making sure that our limits were up to date and that we were protected. And not by any US regulatory agency with health, environmental expertise. The EPA, the CDC, the National Cancer Institute, the FDA, and the Department of Labor have not looked at all of the science. And that's the bottom line. There was no pre-market safety testing for long-term exposure. There's no post-market surveillance for health effects. These are things we do for drugs and for not as much with all the chemicals, but hopefully we're making some inroads. We have a long way to go. But no pre-market safety testing and no post-market health surveillance. There's no monitoring of the radio frequency levels that we're exposed to every day. You're seeing in my community, this is an apartment building with a cell tower popped on 27 feet from the homes, right near bedroom windows. In other countries, there's monitoring for what radio frequency levels we're exposed to. We measure air pollution here. We measure contaminants in water, but we're not measuring the radio frequency level exposures. And there's no evaluation of workplace exposures either, which is really important. We actually have occupational limits in this country that are a little different than public exposure limits, and they allow even higher levels of exposure to workers and our workers are surrounded every day by microwave radiation. Now, there's been no review of impacts to wildlife. In fact, our FCC limits were not even designed to consider impacts to birds, bees, or trees. There's no environmental assessment that has been done on the 5G rollout, despite the fact that the FCC is proposing nearly 1 million new wireless facilities in the United States alone, and there'll be billions of new wireless devices, machines and smart things and all kinds of things we can't even imagine right now for the 5G Internet of Things. So when you go to the FDA website, it says scientific evidence for cell phone safety. And there's even a section that says no new implications for 5G. But actually, there hasn't been research on impacts to the brain by the FDA, impacts to reproduction, children's vulnerability, and of course, not on wildlife. And research hasn't been done by the FDA on impacts from millimeter waves, which are going to be used in new 5G networks. We're going to be using sub-millimeter and millimeter waves, as well as the current frequencies that we use now. So when a mother asked the FDA recently, well, what is, are the levels near my house safe? She actually sent a paper by the company on that had the measurements for radio frequency radiation and asked, is this okay? And how do you know it's safe? And the FDA answered, and she had a cell tower in front of her home. The FDA does not regulate cell towers or cell tower radiation. Therefore, the FDA has no studies or information on cell towers to provide in response to your questions. Now, if you wanna take it like another notch down, cell towers and 5G is a regulatory gap. There is no agency, none, no, not the EPA, not the FDA, no agency with health and science expertise looking at the science to ensure those ambient environmental emissions are safe for us. When I contacted the National Cancer Institute, because I was told by our school superintendent that the National Cancer Institute had looked at the issue and assured us that it was safe, the National Cancer Institute wrote back that their literature reviews, nor the fact sheets talking about their website, they don't make safety determinations. And in fact, if you go to the National Cancer Institute page, although it may seem it's a very long page with a lot of somewhat technical, sometimes information, it downplays the World Health Organization, International Agency for Research on Cancer, classification as radiofrequency as a possible carcinogen. That determination was made in 2011. It doesn't have the research from the National Toxicology Program that Dr. Baldwin talked about that showed DNA damage in the rats and mice. And it doesn't have reference to oxidative stress, which plays a role in cancer development. And there's no consideration of impacts to reproduction or developmental issues in the brain, and certainly not wildlife. So the New Hampshire Commission, with Dr. Davis talked about, had 15 recommendations that really, if you are interested in this issue, it's a good primer to go to the Commission's majority report. They review the science, they had a lot of questions they answered, and they had 15 recommendations to reduce exposure in several ways, and also to raise awareness with a statewide campaign to educate parents and families about how to reduce exposure, and address the lack of accountability in the federal government with the development of federally developed safety limits. And something that I didn't mention that's sort of the backstory is that the Environmental Protection Agency, they were tasked with and working on the development of limits of exposure, amounts of exposure that were going to be allowable in this country, and they were abruptly defunded, just as the Telecom Act was passed and when there was some of the most heavy lobbying that had ever been done in the country, actually, on any one bill in the 1995 and 1996. So another recommendation of the New Hampshire Commission is that the state should measure radiofrequency radiation and post maps for the public. Wireless antennas should be 1,640 feet, at least, away from homes, schools, and parks. And actually, the legislature right now in New Hampshire is taking those recommendations, and there's a proposed bill that's being studied stating that cell antennas have to be 1,640 feet from homes, schools, and parks. So that is being debated, and on our website at Environmental Health Trust you can learn more about that. What we need in the way forward is a full environmental assessment of 5G, an independent assessment to develop proper safety limits that protect humans and the environment. We haven't had it, and it's high time we had a proper independent review. Another recommendation of the New Hampshire Commission was to actually remove and replace the Wi-Fi with wired Ethernet in schools and libraries to address children's exposure. And what you're seeing here is actually it's my computer, and how I use my computer at home when I'm in a fixed place, when I have a desk, is I use an Ethernet. I have an Ethernet adapter, and we have a lot of that information on our website. So you can learn how to hook up your computer without using wireless. There are many governments around the world that are addressing this. They still have a long way to go, but they are far ahead of the United States. And we need to be, I think the United States needs to be on the forefront of this, so we have a lot of work to do. For example, many governments, France, United Kingdom, Spain, Austria, Switzerland, and so forth, several countries, they measure radio frequency radiation. They have public websites where you can go online, pick your location, and see what the radio frequency levels are. You can even, if you live in France, you go to your mayor and you say, I'd like to know what the radiation is right outside my door. And actually, they put in a request, measurements are done, and you're given that information. So there's a lot of transparency. France also has a 5G monitoring station, several places across Paris. It's really interesting if you're interested in this subject to go online and see that. There's also many bans and restrictions on Wi-Fi in schools, bans in kindergarten and nursery schools. Belgium, as well as many private schools, are doing this across the world. In France, in Israel, Cyprus, which also has a directive taking Wi-Fi out of elementary schools, and French Polynesia as well, which has a great educational campaign. And this is my best friend's son. He came over and he's using Minecraft, which is like a whole other issue, addiction and so forth, but he's using it with a wire. And that's an adapter, and you can hook it up so it doesn't always have to be wireless. There are a lot of tips and tricks and things that you can do to reduce your exposure. This is both the medical doctors as well as the scientists that worked on removing Wi-Fi from the pediatric and neonatal units at Archbishop Makarios Hospital in Cyprus. And they actually have a campaign for parents on how to reduce exposure.
Στο Μακάριο νοσοκομείο προφυλάσσουμε τα παιδιά από την ακτινοβολία της ασύρματης επικοινωνίας, ιδίως των κινητών τηλεφώνων και του Wi-Fi. Ο Παγκόσμιος Οργανισμός Υγείας το 2011 κατέταξε την ακτινοβολία αυτή ως πιθανώς καρκινογόνα για τον άνθρωπο. Σύμφωνα με νεότερες επικυρωμένες έρευνες, η μακρόχρονη έκθεση στην ακτινοβολία αυτή είναι πιθανό να προκαλέσει και άλλες σοβαρές επιδράσεις στην ανάπτυξη και λειτουργία του εγκεφάλου, του αναπαραγωγικού, του ανοσοποιητικού και άλλων συστημάτων του εμβρίου και του παιδιού. Να προκαλέσει καταστροφή των νευρικών κυττάρων και του DNA, διάσπαση της προσοχής, διαταραχές στη μάθηση και άλλες νευρολογικές παθήσεις. Τα παιδιά και τα νεογνά, ιδιαίτερα τα πρόωρα, είναι πολύ ευάλωτα και πρέπει να τα προφυλάξουμε. Γι' αυτό, βασισμένη στη διεθνώς αποδεκτή αρχή της προφύλαξης, στους θαλάμους εντατικής θεραπείας παιδών και νεογνών του Μακάριου νοσοκομείου, αποσυνδέσαμε το Wi-Fi. Χρησιμοποιούμε μόνο ασφαλές ενσύρματο διαδίκτυο, συμβουλεύουμε όλους όταν πλησιάζουν τα παιδιά να βάζουν τα κινητά τηλέφωνα τους σε λειτουργία πτήσης, Έτσι, φωτογραφίσουν και διασκεδάζουν τα παιδιά με μουσική και βίντεο, χωρίς να τα εκθέτουν σε επικίνδυνη ακτινοβολία. Γιατί τα παιδιά έχουν δικαίωμα στην υγεία.
Η υγεία είναι δικαίωμα. Δεν είμαστε στερείτε.
Είμαστε περήφανοι για την πρωτοποριακή αυτή έρευνα που γίνεται με την επιστημονική καθοδήγηση και συνεργασία της Εθνικής Επιτροπής Περιβάλλον και Υγεία του Παιδιού. Καταφέραμε να μειώσουμε την έκθεση στην ακτινοβολία σε αποδεκτά επίπεδα ασφάλειας και θα συνεχίσουμε.
Μαζί δείχνουμε το δρόμο και το μακάριο νοσοκομείο εξελίσσεται διεθνώς σε μια πρότυπη όαση υγείας και προφύλαξης των παιδιών από την ακτινοβολία. Γονείς, μάθετε και εσείς πώς να προφυλάξετε τα παιδιά σας στο www.pedi.com.cy σήμερα.
They educate the parents on reducing exposure to their babies, and they even have in the country a major countrywide campaign that includes ads on public school buses about how to reduce exposure to wireless. And we need that. We need a multimedia campaign by our health agencies to educate the public with crystal clear recommendations. Not, if you are worried, here's how you do it, but reduce exposure, this is how you do it, it just makes sense. In fact, over a dozen countries say that. They say children are most vulnerable, it makes sense to reduce your exposure, keep the phone away from your head. France has a directive where phones are labeled, keep the phone away from the pregnant abdomen and the abdomen of teenagers. This is a public education campaign. There's a little 30-second video. They show you different places all through your house about how you're exposed to electromagnetic radiation.
Des ondes électromagnétiques sont émises par la plupart des appareils que nous utilisons dans la vie quotidienne. Pour s'en protéger efficacement et bien utiliser son mobile à la maison comme au travail, adoptons les bonnes pratiques. Retrouvez toutes les informations sur dgun.pf.
Mobilni telefon je prijenosni elektronički uređaj za glasovnu, tekstualnu i slikovnu komunikaciju koju uspostavlja bežičnim spajanjem na mrežu baznih stanica. Štetna elektromagnetska polja najviše se emitiraju za vrijeme razgovora, dok se u stanju mirovanja i s povećanjem udaljenosti mobilnog uređaja značajno smanjuje izloženost korisnika. Izbjegavajte spavanje pored mobilnog uređaja. Dok spavate, ne stavljajte mobilni uređaj pod jastuk ili na noćni ormarić. Budite racionalni s istovremenom uporabom više uređaja.
문자 메시지 이용하기. 둘째, 머리에서 멀리.
This is all on our website at Environmental Health Trust or on our YouTube channel. Companies can bring safer technology to market. There are hardware and software changes that can be done to reduce and to eliminate microwave radiation from the devices. There are networks, they can be designed in communities prioritizing wired connections to the home, through the home, that last mile, so that everything doesn't always have to be wireless. That can be done. And we need the public to be asking for it, and the companies will provide it. All they have to do is get some engineers in a room. Surely we can come together on this. So I'm actually excited about the possibilities of where this can go. Our children deserve safe technology. Wildlife needs to be protected. Our technology needs to be earth-sustaining. And the path forward involves government, the public, and companies. Many hands make light work. Thank you.
Probably the most important thing I did, I was involved as a young scientist in the committee that actually reviewed the data and recommended that there be no smoking on airplanes. You may be shocked to hear that it was even a question for science at the time, but it was. And when I look at what we know now about mobile phone radiation, I see some very interesting similarities.
A growing number of prominent doctors and scientists are raising warning flags over radiation this morning, and your kids could be facing a greater risk of exposure.
I think the most important study is a study by the National Toxicology Program in a classic large carcinogenicity test, one of the largest ever performed, and for that matter, one of the most expensive. They found increased risk of the tumours which we believe radiofrequency radiation is causing in man. Particular tumours called schwannomas. In the rats, they were in the heart. In humans, they're often in the nerve, the ear nerve, the vestibular nerve.
Cell phone providers say they follow all safety guidelines put into place by the FCC. The current FCC safety standard was developed nearly 20 years ago.
The manufacturers actually tell people in the instruction manual, which I've never read, not to put the cell phone against your ear.
It does say exactly that. There's the BlackBerry, for example, warns to keep your phone at least 0.98 inches away from the body when transmitting. With an iPhone, for example, it's 5/8 of an inch.
At this point, the evidence has become sufficiently strong that cell phone radiation is a human carcinogen.
A major development from California's Department of Public Health. High use of cell phones may be linked to certain types of cancer and other health effects, including brain cancer and tumors, lower sperm counts, headaches, and effects on learning, memory, hearing, behavior, and sleep.
If it was a real problem, I would know. If it was a real problem, the government would protect us. How come I'm not hearing about this? They're all things I've heard when I give seminars. You know, I get up there and they say, oh yeah, if this was really a problem, they would have told us. I am they. I am a, legitimate scientist, and I am telling you.